Ask Your Pharmacist Season 3 is proudly brought to you by Dragnet, the Pharmaceutical Society of Ghana, Letter Pharmaceuticals, Chango, U School, and the Tema Christian Eye Center.
Hello and welcome to another episode of your favorite health show, Ask Your Pharmacist. Now, if you've missed any of our episodes, you can find us on YouTube at My Pharmacist TV, on Instagram at _Ask Your Pharmacist, and on Facebook at Ask Your Pharmacist. This show is proudly brought to you by Dragnet. Dragnet, your #1 online pharmacy. Your prescriptions and orders will be reviewed and your medications delivered to you in the convenience of wherever you find yourself. Download the Dragnet app on App Store and Play Store. The Pharmaceutical Society of Ghana, Amicus Humani Generis, pharmacists are friends of the human race. Chango, your platform of trust for group donations. Download the app on App Store and Play Store. Chango for your group and crowdfundings. U School, the most comprehensive school management system. U School provides services from student admissions to payment of fees using a simple short code. Contact IT Consortium on 055 949 7120. or email info@uschoolonline.com and start your journey to effective school management. Letter Pharmaceuticals, Letterman, a multivitamin and mineral supplement for total growth and vitality. Foliron Zinc is a folic acid, zinc, and iron supplement for iron deficiency. Lettermox, your trusted dewormer for the entire family. Contact Letter Pharmaceuticals on 030-222-4613. Tema Christian Eye Center, a comprehensive eye care facility with skilled and experienced professionals and exceptional customer service. You can locate the Tema Christian Eye Center in Tema Community 1 adjacent to St. Paul's Methodist Church. Contact them on 030-2211-999. Tema Christian Eye Center, changing lives through proper eye care. Now do stay with us, we'll be right back.
When on campus and not well, I worry no more. Thanks to Dragnet. With the Dragnet app, I can chat with a pharmacist anytime for my medications, and they are delivered to me right here on campus.
I am a trader. If I need drugs, I cannot leave my goods and visit the pharmacy. All I need to do is click on the call feature on the Dragnet app and I speak with the pharmacist. The drugs are delivered to me right here. Dragnet, ahotoswo papa.
As a businessman, moving around to search for my medication could be very frustrating. But now, with the Dragnet app, I'm able to upload all my prescriptions and have them delivered to me wherever I am. The Dragnet app also allows me to order refills for my mother to treat her chronic illness. Dragnet delivers all the medications to her on time. It's so reliable and convenient. Download the Dragnet app from the Google Play Store or App Store. Dragnet, your #1 online pharmacy.
Araba, there are some people at the door. Go and tell them I have traveled to Russia.
Yes, Daddy.
Where's your father?
My father said I should tell you he has traveled to Russia.
Your father has killed me. I sent him money from America to complete my house for me.
Are all student association contributions?
Even the money from the fundraiser for Kweku's surgery.
Oh! He too? Don't be a victim. If you're contributing to a project, alumni dues, or any public campaign, Chango is your best choice. Chango keeps track of all donations and gives you the power to know exactly where the money goes. Chango is approved by Bank of Ghana. Call 0270-066-614 or visit changoapp.com for more information.
Uncle, my father is hiding under the bed.
Oh, Araba.
Chango for your groupings and crowdfunding.
Welcome back Thank you for staying with us. Today we come your way from the Tema Christian Eye Center. I have here with me Dr. Eric Redu. Hello, Doc.
Hi.
He's an optometrist here at the Tema Christian Eye Center. And today we are discussing comprehensive eye care. So, Doc, what is comprehensive eye care?
Okay, so comprehensive eye care actually has to do with everything that goes into making sure that your eyes stay healthy and they function to the best of their ability. I look at it as a two-way thing. There are caregivers and there are caretakers. We as doctors give the care. You as the owner of the pair of eyes, you take care. So in wrapping everything up, I'll actually say that comprehensive eye care doesn't start with your doctor. It starts with you, the individual, and how you take care of your eyes. Yes.
Right. So you own the eyes, they are your responsibility.
Yes, primarily.
Okay. So as a doctor here at the Tema Christian Eye Center, what are some of the common eye conditions that you come across?
We come across conditions like glaucoma, cataracts, we have conjunctivitis, infectious or allergic. By infectious conjunctivitis, we have conditions like bacterial conjunctivitis, viral conjunctivitis, what people call Apollo, just to name a few.
Right.
In addition to that, we have refractive errors, we have corneal diseases, we have retinal cases and all that, yeah.
Okay, so for the purpose of this discussion, we would want to zero in on glaucoma and viral conjunctivitis.
Okay.
So to start with glaucoma, what are the causes of glaucoma?
Okay, so let me start from the definition of what glaucoma actually is.
Right.
There is a misconception that glaucoma is high eye pressure, or there's glaucoma is eye pressure.
Okay.
But glaucoma is not eye pressure simply because we are born with eye pressure. It's essential for the functioning of our eyes. So for someone to actually have glaucoma, it means that there is some form of nerve damage actually happening to the optic nerve.
Okay.
That is what chiefly helps us to see. In the absence of that, there is no glaucoma. You could possibly have high eye pressure, which does not cause any nerve damage, and so there's no glaucoma. We just call it as such, high eye pressure or ocular hypertension. And you could equally have normal eye pressure or pressure within the normal range, and you will still have some form of nerve damage going on. Okay. So essentially, it's not eye pressure, it's nerve damage,
right?
Regardless of what the fundamental cause is. So that's glaucoma.
So what are the clinical manifestations of glaucoma? Okay,
in its very, very beginnings, you wouldn't realize anything. No pain, no headaches. For the commonest type of glaucoma we have, and that's the primary open angle glaucoma. But in types like the closed angle glaucoma, especially with acute angle closure glaucoma, you would have things like redness, very severe pain, photophobia or sensitivity to light. Some even go to the point of having nausea and very, very pounding headaches. Right. But that is very, very rare, let me put it that way. Okay. For the commonest type we have around, nothing will be experienced by the patient. You wouldn't even see any change in how you see or anything of the sort until in its very advanced stages. That is when you begin to realize that there has been a significant change in your vision. Yes, that's the only way. So then that would be the reason why it's important to periodically have your eyes checked. Exactly. Since you can't by yourself tell if there's any difference going on. Exactly. Right. So when we talk about treatment, how is glaucoma managed? Mostly glaucoma is managed by eye drops. Okay. These drops are given to regulate your eye pressure importantly. Okay. Because that is the most controllable cause of glaucoma or its progression. So you start treatment with drops. There are different drops with different potencies. If it gets to a point where you are on maximum therapy and your pressure is still not being controlled effectively, then we go in for surgical treatment. Okay. For a good number of cases, even the surgical treatment in itself doesn't completely control the pressure. Some have had to have surgery. Afterwards, they go back to eye drops anyway. So the mainstay of glaucoma commonly is the use of eye drops. There are people who come to us with questions about herbal medication and all that. Herbal medicine, even in Ghana here, has been shown to be useful in treating certain conditions, but unfortunately, our herbal medicine hasn't reached the point where it treats eye diseases or conditions, not to talk about glaucoma. So.
Right. So in the space of prevention, is there anything that, my viewers can do to prevent glaucoma?
Yes. To talk about prevention, it will mean that we would have to take a look at some causes that are controllable.
Okay.
For instance, glaucoma can be caused by the use of certain medications called steroids, corticosteroids. Over a long time, these have been known to increase your eye pressure. And when that happens, it causes nerve damage. That's glaucoma.
Right.
To be able to avoid glaucoma from such a cause, it means that you would have to use drugs like corticosteroids only as prescribed. At the end of the period, you don't self-prescribe and continue using even at the end of the period. Things like trauma to the eye can also increase the eye pressure. In that case, you should just avoid anything that is threatening to your eyes by way of trauma, because then when the pressure goes up, you might not know, then the nerve damage starts. That's another thing you can do. Then we have systemic conditions that have been known to have effects on the eyes, and by so doing, they have a way of increasing your eye pressure and can give you glaucoma. I'll name a few. Hypertension, diabetes. If you are known to have any of these conditions, do your best to control them as much as possible. In the absence of that, you should know your family history. Glaucoma has a very, very strong genetic correlation. So if you know your family history and then you know that there are people in your family who have glaucoma, immediately you should make it your responsibility to have very, very frequent eye check, because once it starts, if we're able to see it early, then we can do a lot to help save your sight for the rest of your life. But otherwise, when glaucoma starts, if you don't have any eye exam, by the time you come in, the damage has been so extensive, and unfortunately, there is little we can do to help at that point. Even though we do our best to retain what is left, we can't retrieve what has been lost due to the nerve damage.
Right. So we are coming your way from the Tema Christian Eye Center. We're talking about glaucoma, and Dr. Redu has made us understand that it's important to know your family history. It's important that you don't overly use over-the-counter medicines on your eye. You should be using prescribed medicines. Do well to always ask your pharmacist or go to a clinic and get your eyes checked before installing anything on your eyes, because some damage is irreversible. Don't go anywhere. We'll be right back.
Are you a proprietor seeking to notify parents on fees payments, arrears, and PTA meetings? Or are you the busy proprietor who needs an all-round anywhere access to your school and its administration? If you answered yes to any of these questions and more, then your problem is solved. USoft Solutions has the solution for you. USchool. USchool is a robust school management system which is tried and tested with over 8 years track record. USchool has rich modules for admissions, fees payment, fees billing, academic reports, journal ledger, messaging, petty cash, and many more. By dialing *789*800#, parents can pay fees directly to the school's bank account, receive SMS receipts for the payment, and a link to download electronic receipts in PDF. Our SMS model allows you to send unlimited SMS messages on fees payment, fees billing, student outstanding fees, and any other messages. All transactions and payments go through an audit and validation process, so you know who collected what and when. With a single sign-up, you get to enjoy all these without any hidden charges. Call USoft Solutions today on 0559 497 120 or register at www.uschoolonline.com or email info@uschoolonline.com and have a stress-free school management. USoft Solutions, empowered to do more.
Yamamu Akwa Deba Tema Christian Eye Center. Eye eni yaresabia Tema Christian Eye ini asabia yehwe iniyare bia efri nkolamu ekosi impenimfo so se efa nia ewose ma withdraw ana se ne be operation ana se uhia space in kwa your dispensary fully functioning dispensary edro bia ehia se ewose edema na udigu weni so mane kono ubenye bi yedbema ohumbeto ne ehia se eye operation bia no ahanso ye ma se etchire so kana se laser na uhia eno nso yeyebu otema Christian Eye Center ha ye ejuma fiti ejuada kopin memnenda aye Monday to Saturday ye wo tema committee 1 opposite Golden Chopstick Restaurant ana se utumi bisa se St. Paul's Methodist sorry no
Tema Christian Eye Center, changing lives through proper eye care.
Welcome back. Thank you for staying with us. We are here at the Tema Christian Eye Center. We're having a lovely conversation with Dr. Redu. We just went through glaucoma, its clinical presentation, how you can manage it, and what you can do to reduce your risk. Now we're continuing with Apollo. Stay with us. So, Doc, Apollo,
yes.
You mentioned it earlier. That's viral conjunctivitis, but we call Apollo. So, what is viral conjunctivitis? What causes it, and how was it spread?
Okay, so like its name suggests, it's viral conjunctivitis. It's caused by viruses, Coxsackie virus and then enterovirus. These are the known viruses that cause it. Besides the causative agents, I would like to touch on its mode of spread. We have realized that it works by contact mostly.
Okay.
So for instance, if I have the Apollo, right, and I'm teary, if you should touch my face whilst the fluids are flowing out of my eyes, and you fail to wash your hand, and in the next moment your eyes are itchy and you try to rub, there you have it. If, let's say, I should try to clean some of these discharges and fluids out of my eye and I don't wash my hands, and I should touch any object, and a few moments later you should also come and touch it without washing your hands, there you have it. You have just infected yourself. If anything happens to your eyes and you try to react by putting your palms or your fingers in there, you've infected yourself. Sharing of physical items, especially things like pillows and towels and all that, you could easily leave the infection in there. The next person who uses it with you also gets the infection, let me put it that way. So these are the commonest ways through which it spreads. Unlike most people think, if someone has it and you stare in their eyes, you are going to get some. I don't know how that works, but
right.
Yeah.
Okay, so like Dr. Redu mentioned, you don't get Apollo by staring in my eyes. That's not how it's transmitted. It's transmitted through body fluids. So the tears of someone who's already infected. So if you do have Apollo, there are a number of things that you can do to ensure that you don't spread it to the people around you. Doc, you want to share some light on that?
Yes. You, the one who is infected, keep your hands clean, because in a shared space, the tendency of you touching items that others are also going to touch is very, very high.
Right.
For instance, if I should have any discharges coming out of my eyes and I should clean them, right after cleaning them, I need to wash my hands before I touch anything else or someone else.
Okay.
If you also happen to be in the space of someone who has it, it means that if you touch anything, you shouldn't touch your face.
Right.
Until you have washed your hands. And then also for someone who knows that they have it, please do well to visit your nearest eye doctor or your regular eye doctor for him to examine and then give you treatment. If it is possible, when you are infected, avoid large social gatherings, because then nobody knows, but you could take your hands into your eyes or your face at any moment and
touch something
out
else.
of social courtesies, you meet someone, you try, oh, hello, hi, you try to greet the person, and there, you just spread the thing to the next person.
Right.
So yeah, these are some of the things you can do. And for those who work in offices, with a number of colleagues sharing the same space. If it's possible, you should take some time off work when you have that, because then you don't get to spread it to anyone else. It's better for you to be absent than to have an office of about 6 to 10 people and everybody is infected.
Right.
I think that's counterproductive.
Thank you so much. So looking at viral conjunctivitis and glaucoma, which we discussed earlier, are there any complications that may set in if they are not treated early or treated properly?
Let me lump all this together.
Right.
Okay. There is a general perception that the older you get, the worse your vision should be. That is not how the eyes were made to function. What you can do is that with anything that changes in your eye, whether it's the clarity of your vision, if you see any new symptoms, any discharges, any sudden, severe or slight pain, just check in with your eye doctor. We have a certain habit where we like to wait till late before we check in with our doctors. Commonly we say, let me wait and see. Okay. When it comes to your eyes, waiting would only make you not see. And I'm saying that because your safest bet is seeking early intervention for your eye conditions. It is better to have had your eyes checked and your doctor tells you there's nothing wrong with your eyes than for you to sit back and presume that it's nothing wrong, only to realize that something has actually gone wrong in your eyes. Because for most eye conditions, the worst case complication is blindness. And trust me, it is that easy to get blind from things that you might consider to be very simple or not harmful, because there are a lot of changes that can happen in your eye and they wouldn't necessarily give you any warning signs, but it is when you seek early intervention that some of these conditions are discovered and treatment instituted.
Thank you, Doc. Now, when we talk about comprehensive eye care, like you had mentioned initially, it has to do with the caregiver and the owner of the eyes. So here at Tema Christian Eye Center, as caregivers, what facilities do you have to offer for comprehensive eye care?
Okay, so for comprehensive eye care, we do everything we need to do for you. I would mention a few of them. As a standard procedure, there are certain tests you should do as part of your comprehensive eye care. Some of these tests will help review if there are, should I call, much serious stuff going on with you. If needs be and you need advanced care, then we know what to do from there. So we would usually check your visual acuity. That's more like a way of measuring how you see. Okay, and we would examine your eyes from the externals. We'll examine the internal part of your eyes. We're going to check your eye pressure. There's a procedure called refraction, which measures how you see and what sort of lens correction, spectacle correction you might need.
Right.
We also prescribe medications. If you need optical devices like spectacles, we do prescribe them as well. We also have surgical interventions for a plethora of eye conditions. So we go the whole 9 yards. From these, we have primary care doctors, we have specialists, both locally. By local, I mean from Ghana here.
Okay.
We have international doctors we work with from all over the world. So whatever the condition is, we are in a good place to handle it appropriately. And I think we've done that so well for so many years. So yeah.
Thank you. Whatever the condition is, do get in touch with the qualified and experienced doctors here at the Tema Christian Eye Center. So, Doc, to close off, your final words for my viewers.
My final words. It is good to enjoy life, but you can actually only enjoy life when your eyes are healthy and you have good sight. So I would say, in your bid to enjoy life, just make sure you have healthy eyes and good sight.
Thank you so much. Up next is Dose for Healthy Living.
You're welcome to today's episode of Dose for Healthy Living. My name is Carl, and we come your way today again with yet another exciting and insightful show. And today I'll be interacting with Farm Dr. Oduo Asari, who is a pharmacist with Dragnet. You're welcome to the show, Farm.
Thank you very much.
Right. So, Farm, I know most of our viewers today are culprits of this act of opening oral antibiotics into their wounds. What is your advice, and are there any effects that happens after they do this?
Thank you very much for the question. So antibiotics come in different dosage forms and are administered through different routes. For example, this is a very common drug, red and yellow. It's made to be administered orally, but most people apply it directly into their wound. So they take the capsule, they open it, and they pour the contents of the capsule, which is the powder, directly onto their wounds. And this is wrong. And irrational use and abuse of antibiotics leads to resistance. So everyone is cautioned not to take drugs on their own without speaking to a pharmacist. You walk into the pharmacy, you speak to the pharmacist. When they give you the drug, they will tell you the right way to take it and the right way it should be used. Thank you very much.
Thank you. So viewers, you heard it right. The use of oral antibiotics into our wounds is wrong and could lead to antibiotic resistance. Let's desist from this act. My outfit was made by Yao Darko. You can follow him on all social media handles at Yao Darko. Thank you for watching. See you next week.
Thank you for being an active part of your health by taking the responsibility to watch your favorite health show, Ask Your Pharmacist. Now, this show is proudly brought to you by Dragnet, your #1 online pharmacy. Your prescriptions and orders will be reviewed and your medication delivered to you wherever you are at your convenience. Download the app on App Store and Play Store. The Pharmaceutical Society of Ghana, Amicus Humani Generis. Pharmacists are friends of the human race. Chango, your platform of trust for group donations. Download the app on the App Store and Play Store. Chango for your group and crowdfunding. U-School, the most comprehensive school management system. U-School provides services from student admissions to payment of fees using a simple short code. Contact IT Consortium on 055-949-7120 or email info@uschoolonline.com. Letab Pharmaceuticals, Letamin, a multivitamin and mineral supplement for total growth and vitality. Foliron Zinc is a folic acid, zinc, and iron supplement for iron deficiency. Letamox, your trusted dewormer for the entire family. Contact Letab Pharmaceuticals on 030-222-4613. Tema Christian Eye Center, a comprehensive eye care facility with skilled and experienced professionals and exceptional customer service. You can locate the Tema Christian Eye Center in Tema Community 1 adjacent the St. Paul's Methodist Church. Contact them on 030-2211-999. Tema Christian Eye Center, changing lives through proper eye care. Now, this lovely outfit I'm wearing is from Ladi Asaki. You can find Ladi Asaki on Instagram at Ladi_Asaki. The contact is on your screen. Thank you so much for joining us for another episode of Ask Your Pharmacist Health Show. If you've missed any of our earlier episodes, you can catch us on YouTube, My Pharmacist TV, on Instagram _Ask Your Pharmacist, and on Facebook, Ask Your Pharmacist. See you next week.
Ask Your Pharmacist Season 3 is proudly brought to you by Dragnet, the Pharmaceutical Society of Ghana, Letter Pharmaceuticals, Chango, U-School, and the Tema Christian Eye Center.